Hey everybody, thanks for watching Your Oxford. I'm your host, Jerry Accioni.
And I'm Sarah Accioni.
We are here on location at Upper Thames Brewing Company again, so pardon a little bit of background noise, but this is kind of the feel we wanted anyways.
That's right.
On today's episode, we are talking to Barb Ledgley. You're a school nurse for the Oxford County Public Health.
That's right.
Awesome.
Thanks so much for joining us.
Thanks for coming today.
I'm glad to be here. It's back to school, so it's
Yeah,
the right
it
time
is.
to come. Yes.
Work started.
Rude
Lots of
awakening for
questions.
everybody. Yeah.
Well, do you get the summer off though, like teachers?
I personally don't work in the summer, but some of my
nice.
colleagues do, so I guess I'm the lucky one. But I had to come back and get going
Come
again.
back
But
to work,
actually,
get going.
it's been really nice getting back into the schools and seeing everybody with their September enthusiasm and.
Yes, if only that would continue through the year.
We'll try to keep it rolling as long as we
Panic
can.
grade 9,
Yeah.
you'd see.
I was visiting with grade 9s at Glendale High School this morning in Tilsonburg. They had a welcome pancake breakfast, so I was introducing myself as their school nurse, and they seem to have weathered the first week. Okay.
Oh, yeah.
Yeah,
that's
we
good.
have one in grade 9 as well, and
That's
well,
fun.
We're just glad the first week's over.
Yeah.
Yeah, it's the getting out of bed that's the biggest problem
Well, it
for
is. Yeah, it's that
everybody.
routine again, right?
Absolutely.
So, what is the role of a school nurse?
That is a really big question because as a school nurse in Oxford County, we do visit all the schools, elementary, secondary, both boards, the London District Catholic School Board and Thames Valley, as well as the private schools. But there's not a lot of us, so we're not in the school every day. I'm not there with a first aid kit and bandages. But our role is kind of health promotion.
Okay.
So if a school has a particular health need, we will certainly try to address it. You know, anything from mental wellness, well-being, nutrition programs, physical activity. We can work with the school staff to kind of develop a healthy school in that way. And I know that's pretty vague and broad, but we can do
But that's what
anything.
you are. Yeah.
I have
Very
done
broad.
events where we bring a bike that makes blender smoothies to promote nutrition, and we've done kindergarten hand washing, and I do like one-on-one health visits with high school kids. So it's pretty broad, but it's fun.
It's just an evolving kind of situation then, depending on the school and the age of the kids.
Yes.
And
Yeah,
That's
that
correct. Now, to be fair, I do try to spend a little bit more time in the high schools when I can, because that's such a interesting age for transitions and
Interesting
stressors.
age. Yep.
And I think that providing another resource in the community for building their resiliency and just their capacity, knowing that there's people that can help them, it's really important to be in the
it's
high
a safe
schools.
environment for them too, right? They may not feel comfortable talking to mom or dad about stuff, but they can come to the school nurse who's kind of that innocent bystander
That's true.
and
Sure.
point them down the right path.
Yes,
And that's key, right?
It
Because
is
you
definitely true.
do with the public health. I mean, you've had lots of different avenues they can go, or a lot of people you can point them
Yes,
to for
yeah. Like
assistance.
I'm kind of the school nurse, but like I said, I'm not in there every day. I was explaining to the students at Glendale this morning that I'm there every Wednesday, but you might not have an issue on Wednesday, so you can definitely call anytime. But I work with public health dental department as well. If people are in a situation where they don't have dental insurance and they're needing some dental support, that's available. Our dental team does screening in all the schools. They're actually doing some new screening this year in the high schools with grade 11 students to see if they can catch some problems while the kids are still eligible for the subsidized program.
Okay, good.
I work with a couple of great dietitians, but particularly Kelly Ferguson, who's the school nutrition program coordinator. So we do nutrition events, and we're trying to get people to make healthy choices that way. It's not always the easiest message to get out there, but
And teenagers,
little by little.
Teenagers like their fries, they like poutine, they like anything fast and easy, right?
But you would be amazed. We had a fruit parfait day at one of the high schools in the spring, and the youth just jumped on it. When
free
these choices, when the healthy choices are available, they will go for it. Yeah.
They like low maintenance. If it's ready right in front of them, they're all over it.
And that's a really good back to school tip. As a mom, I'm not very good at it personally, but having the fruits and veggies chopped up in the fridge, having those kinds of things available so that when they start opening cupboards and opening doors, they're not just finding the chips and the easy things. They can see, oh, hey, the carrots are already cut up.
Yeah, we get that all the time. There's no food in this house.
Yes.
Doesn't matter if you
it's
just spent
food that requires preparation. There is food.
If you have somebody in grade 9, I know why you have no food in
Well,
your
that too, yes.
9 to 12.
Yeah.
They eat
just
very well.
Yeah, well, that's wonderful. So it's really hard to say what the role of a school nurse is, but we work with the community. We're going to be doing a program upcoming through the fall with the Woodstock Art Gallery, and it's going to be targeting grade 5 and 6 students to come into the library to learn a little bit about body image through art, and we're going to give them a little bit of talk about body image, self-esteem, and kind of those issues that are so prevalent. You know,
it's important that age group too, because that's when things really start to kind of change.
Absolutely, and I think that's why they've chosen that age with their program, is because that's when your image out there on social media becomes so important and can kind of take over.
Never goes away. Constant.
So yeah, if we can give them some skills to kind of build that resiliency, then, because we all know that mental wellness is such a big issue in Oxford and everywhere.
Right.
The more we can kind of be those adults that they can trust. Yeah, exactly. So
now, if anybody does have any public health questions, how can they get a hold of you? How can they get a hold of your team?
You can call the health department anytime. We're part of the County of Oxford, so I don't know if you want our phone number.
Sure.
It's
Yep.
519-539-9800.
Okay.
Just ask for a public health nurse. Most of the schools know who their school nurse is, so you can contact us through the website as well.
Okay.
We try to be on Facebook. We're not as good as you guys, but we're getting
Well, you have
there.
a lot to do, though. You're spread thin.
Yeah. Well, that's just it. Back 3 days, and my calendar's getting full, and it's great.
Yep.
I'm happy to
very
be
good.
here,
We
so.
really appreciate you finding the time to squeeze in here, especially start of the school year. Kind of spread the word. And
It's the Upper Thames Brewing Company. I mean,
yeah.
who wouldn't want to come to check that
no
out?
to that? Thank you
Yeah,
again,
They're
guys.
empty glasses.
And you guys. Well,
Yeah, we're the secondary.
remember
That's
that I
right.
am the school nurse too, so I'm not
good
gonna.
point.
There's some healthy components to beer.
I'm sure there
It's
are.
natural.
It's wheat. It's a
Yeah.
vegetable, isn't it? Grain? What is it? It's healthy.
I'm not sure that the dietitian would put it on the suggested thing.
We're just going to go on to the next topic.
All right, I'm
We'll
sorry.
just leave that there. Yeah. Okay.
Water's good too.
Water, yes.
Thank you so much for joining us here.
Yeah,
in
no,
Euro
thank you for having
letting
me.
us spread the word. And
Yep.
if you got anything upcoming, make sure you reach back out to us.
We will,
We'd
yeah.
love to have you on again,
Yeah.
or any of your teammates. Of course,
I'll
there's a
bring them
big
next
crew.
time. There's a couple school nurses, and then lots of public health staff
Excellent.
as well.
We know a few as well.
We do a lot behind the scenes to keep people healthy. So.
Very good.
Okay.
All right.
Thanks.
Thank you. And thank you, of course, for watching Your Oxford. Again, big thank you, Upper Thames Brewing Company.
Thank you.
Again, gave us our space. It's a brew day, so you probably can hear a little bit here in the background, but that's okay. Again, it's that feeling. We're at somebody
It's
else's
live.
room.
It's live, Oxford. This is what happens here.
Yeah. Anyways, till next time, don't forget, like, comment, tag a friend that would be interested, and share. We'll see you later, everybody.
Till next time.
Bye.